Modern healthcare is moving away from purely reactive treatments. The industry is shifting toward proactive, predictive medicine based on analyzing vast patient data. Tools like telemedicine, automated diagnostics, and the processing of big data are no longer experimental concepts. They are the baseline standards of global patient care. But there is a severe lag in how we train the people using these tools. Standard medical schools are producing physicians who are clinically competent but computationally illiterate. When doctors cannot understand the mathematical logic behind an algorithm, they cannot critically evaluate the automated systems that are increasingly recommending life or death decisions. A modern physician without advanced data literacy lacks the tools required to operate effectively within the current reality of the healthcare industry. To address this knowledge gap, Telkom University is launching a new faculty of medicine. The institution is leveraging its deep roots in ICT to engineer a new kind of medical program. This diagram illustrates the SKDI 2021. The Standard Competency Doctor Indonesia is the strict, non-negotiable regulatory baseline that dictates national medical competency in Indonesia. Rather than appending IT electives to the end of this syllabus, Telkom University structurally hybridizes the curriculum with digital health principles from the very first day of class. By injecting digital data literacy directly into the foundational medical sciences, the traditional framework is structurally and intellectually upgraded. This approach reconstructs the educational blueprint, aiming to produce a natively digital doctor rather than an analog doctor with a tech hobby. Developing this program requires strict adherence to the duration requirements set by the Indonesian Medical Council, or KKI, and the Independent National Accreditation Agency, LAM-PT-KES. This timeline illustrates the chronological journey of the curriculum. It is divided into two distinct phases, a 7-semester academic block and a 4-semester clinical profession block. During the academic phase, core subjects like molecular biology and gross anatomy are taught synchronously with medical information technology and bioinformatics. Specific local integration modules are embedded throughout this phase. Students learn safe AI, big data analytics, and telemedicine alongside their foundational biomedicine. When students transition into the clinical phase, they must apply clinical informatics and manage real patients within complex, data-rich hospital environments. By interweaving these disciplines chronologically, students internalize computational logic as a core science that is equal in importance to human anatomy. This diagram outlines the actual competency requirements within the standard SKDI framework. It operates as a network of 7 interconnected areas of medical proficiency. If we zoom into the information management node, we can see exactly how technology elevates standard practices. Telkom pushes this requirement past basic literature reviews. Students are trained to actively synthesize clinical data using secure, intelligent algorithms. Moving over to the scientific foundation node reveals a similar expansion. This includes biomedical engineering, allowing students to map disease through a combination of biological, genetic, and computational data. Finally, the clinical skills requirement integrates the Internet of Medical Things, or IoMT, which refers to physical medical devices connected to healthcare IT networks directly into standard patient care. Transforming these core nodes takes a traditional regulatory framework and turns it into a highly advanced operational manual for modern medical practice. To ensure graduates can execute this operational manual, the university uses a proprietary architectural profile for its physicians. This graphic illustrates a unified, 3-layered competency model, often summarized as the right person doing the thing right. The core innermost layer represents personal and professional competence. Strict moral integrity and adherence to the university's institutional ethics, known as the HEI culture of harmony, excellence, and integrity, are absolute prerequisites. The middle layer is intellectual, analytical, and creative competence. This area is driven by computational thinking and the use of clinical decision support systems, or CDSS, which are AI tools that assist in medical diagnoses. The outermost layer is technical competence, focusing on the precise physical execution of standard clinical skills, combined with IoT medical tools. Technological execution in the outer layer is inherently dangerous and useless without the analytical logic of the middle layer and the moral integrity of the core to anchor it. This diagram shows the safe AI framework. It directly addresses the ethical tension of delegating diagnostic power to artificial intelligence. The secure principle establishes basic cybersecurity as a mandatory medical skill. Doctors must know how to protect highly sensitive patient privacy against breaches. The accurate principle demands mathematically rigorous clinical validity from any algorithm. The data must be reliable to minimize the risk of an automated misdiagnosis. The fair principle requires auditing training data to prevent algorithmic bias, ensuring the technology serves all demographics without systemic discrimination. Finally, the explainable principle rejects the concept of black box decisions. AI logic must be entirely transparent and traceable. The safe AI mandate ensures doctors retain absolute professional control and ethical responsibility over automated systems. Human judgment is never subordinated to a machine. Teaching this curriculum requires physical infrastructure that looks more like a high-performance data center than a traditional medical school. The Telkom University Landmark Tower, or TULT, serves as the multidisciplinary hub. It houses the AI and Healthcare Data Lab, which is equipped with NVIDIA A100 GPU clusters and petabyte-scale storage. This massive computational power sits alongside the Clinical Skills Simulation Lab, where students practice on high-fidelity mannequins integrated with sensory monitoring to provide real-time feedback. To guarantee national clinical rigor and academic quality control from day one, Telkom University operates under a strategic mentorship with Universities Islam Bandung, or UNISBA. Through a partnership with RS Otomo, students operate within a live clinical sandbox where they test hospital CRM systems, integrated SIM-RMS management software, and automated monitoring on real patients. This physical network forces students to leave theoretical isolation and validate their digital concepts in an unforgiving, real-world clinical environment. This map illustrates the broader ecosystem of the Telkom Group, coordinated through the Telkom Health Foundation, or YKT. Telkom University acts as the central hub, linking to RS Otomo, Telkom Medica Clinics, and the MyIndyBiz Health platform. Access to platforms like MyIndyBiz Health and the Telkom Medica Clinic network gives students the tools required to practice population health management at a national scale. At the local level, students utilize AI-driven mobile applications to facilitate early chronic disease detection and execute stunting prevention programs within nearby communities. Zooming out, Telkom University is actively engineering the workforce required to fulfill the Indonesian Ministry of Health's digital transformation roadmap. The result is a practitioner fluent in human empathy and algorithmic logic. The future of medicine belongs to practitioners who can wield the vast analytical power of AI without ever losing the ethical, human-centric touch of the physician.